Europe is preparing for an even bigger wave of new infections of COVID-19. The more contagious Omicron variant is quickly becoming dominant. It's feared the number of new cases will climb to new records as more testing is done following the holiday season. France's parliament is debating whether to limit access to more public spaces and only allow entry for the vaccinated. Each country is grappling with the way forward.
Rome, days away from tougher restrictions. Italy is one of so many European countries again faced with and braced for increased hardship in the form of regulated movement, tougher economic times, and overflowing intensive care units. The director of this Rome hospital says for a month we have been systematically full. Stark contrast to last summer and fall in Rome, when infections were down, restrictions were relaxed, Italy was reopening, and business was on the upswing. Such was the case across much of Europe as countries took a breath in hopes the worst might be over. Then came winter and the spread of Omicron in southern Europe and in the north. Like Italy, Denmark's reopening was brief. Now it is breaking caseload records with the highest ratio of infections per 100,000 inhabitants in the world. It's certainly worrying that we're seeing a continued high level of infection, and we're now seeing this more infectious Omicron has taken over. Officials maintain extensive testing has pushed Denmark's case numbers higher than countries that do less testing and less vaccinating. Countries like Romania, where a fifth wave appears imminent, especially after gatherings during the holidays. This in a country that is next to last in Europe when it comes to vaccination rates. That means it's near the bottom in what is now the global epicenter of the pandemic.
Joining me now from Geneva is epidemiologist Marcel Salate. As Omicron spreads, interestingly enough, hospitalization rates aren't shooting up at the same pace. What's this decoupling of the numbers say to you?
That's right. Thanks for having me. So Omicron is a package with good news and bad news. On the bad news side, it's more infectious. It transmits more easily among the population for a multitude of reasons. On the good side, it seems to be a little less severe. And so what we're seeing is a combination of these things. We're seeing case numbers go up extremely rapidly across Europe and increasingly across the world. But we're not seeing the hospitalizations number going up as rapidly as they would have if we would still be in a Delta-dominated world.
But Marcel, couldn't this be good and good in that Omicron takes over from Delta and other variants and spares us all a lot of pain and hardship?
I think in the long run, it's good. It's good news because this virus is extremely transmissible. It will find any pocket left that hasn't seen the virus before, either through infection or through vaccination. And so it's possible that this variant denotes our transition into the endemic phase. The problem, of course, is if you have such high case numbers, even if you have proportionally lower hospitalization rates, you still have a tremendous burden on the hospital. In addition, if everyone is out sick at around the same time, even if it's a mild disease, that puts a lot of burden, of course, on the general infrastructure, not just the health systems.
OK, so how would you sum up the government reaction? Are governments overreacting with reintroducing strict measures?
Well, it depends. It's really hard to say from one country to the next. I think most countries, certainly in Europe, but I guess elsewhere as well, are now trying to navigate this phase by saying we want to keep things open as much as possible, but we just don't want to risk an overwhelming of the healthcare system. Healthcare capacities are slightly different in different countries. Vaccination rates are different in different countries. So you will see different strategies in different countries, but I think they all have the same goal.
But for those who haven't been vaccinated, it's still worth getting that vaccine to make sure you don't get a severe case?
Yes, absolutely. Look, the most dangerous encounter with a virus is always the first one, when your immune system is not ready yet. And that happens either because you have not been vaccinated or because you didn't have it before. So in either case, right, getting the shot is good. If you had the shots before, then getting a booster is good because that protects even better against Omicron.
Now, just briefly, this latest variant that's come up, I'm not talking about Omicron now, it was detected in France and traced back to Cameroon. Should we be concerned about that one?
Well, I mean, as a general measure, I would say, let's look at all variants with some concern. Now, this one, I have to say, at this point, I'm not particularly concerned because, interestingly, it actually predates Omicron. It's only the media that's now picking up on it because there have been preprints that have been coming out in the past few days. But it's actually been discovered before Omicron. And it didn't stand a chance against Delta at the time, so I don't expect it stands a chance against Omicron. But it's good to keep an eye on it, but certainly no reason to panic.
Good to see the media is also picking up on it. Marcel Salati, epidemiologist, thank you very much for being on the show today.
Thanks for having me.
Here are some more of the latest developments in the pandemic for you. The United States has set a new global record of over 1 million new coronavirus infections. That's according to data collected by the Johns Hopkins University. Australia is also reporting a record number of new infections and hospitalizations. The country has now surpassed a total of 500,000 cases. And India's capital, Delhi, has announced a weekend curfew to try to curb rising infections in the metropolis, home to 11 million people.
Well, let's talk about this with Martin McKee. He's a professor of European Public Health at the London School of Hygiene and Tropical Medicine. Professor McKee, Omicron is spreading fast, but there's hardly any talk of severe disease or even death. The variant seems mercifully mild. Are governments overreacting with reintroducing strict measures?
No, I don't think that they are. And it's certainly milder than the Delta variant. But I wouldn't say that it's actually a disease that you can just dismiss as being trivial. We certainly are seeing quite a number of people being admitted to hospital, not to anything like the same extent as before. Also some worrying data from a number of countries that children are being admitted and some of them are getting seriously ill. But the other thing that we need to remember with this is that we've tended to think of this as a primarily respiratory disease, and that, of course, has been a major part of the presentation. But this is a virus that can affect many different parts of the body, and we're particularly worried about the long-term consequences, what we call long COVID. We still don't know anything really much about the extent to which Omicron will be driving problems with that as we go forward. So I think we need to be really very cautious.
So the example of Denmark shows that a high vaccination rate against an infection with Omicron is not really sufficient. Does the response of European countries to high infection rates have to be boost?
I and over 100 other people wrote an open letter in the British Medical Journal that was published yesterday that argued very strongly for a vaccine plus policy. Vaccines are going to be very important. Omicron can evade the existing vaccines to some extent. We almost certainly will need newer vaccines going forward. But the vaccines are still providing a degree of protection against Omicron. And of course, they are protective against the other variants that are circulating. But they're not enough on their own. And I think we're seeing that in the countries that are very highly vaccinated, like Portugal and Spain, for example, where you're seeing rising cases despite great progress with the vaccine. So that means that we need this multi-layered approach, which has vaccines, which has testing, and which has measures to reduce the transmission. We need to just keep coming back to the fundamental point about this virus. It is spread primarily through the airborne method, and that means that it's transmitted in places where people come together in enclosed indoor spaces where there are large numbers of people, and that's where the risks lie, and we need to minimize those risks.
Well, there are now media reports about a new variant that was detected in France and has been traced back to Cameroon. Do healthcare systems already need to prepare for the next mutation, and can they?
Well, health systems do definitely need to prepare for the next new mutation, but whether or not we need to be too worried about this one is another question. It does seem that although there is some localized spread in parts of France at the minute, Omicron does seem to be out-competing it. But that doesn't mean that we can be complacent with it. French authorities are monitoring this very closely. But if I had to guess, and one obviously is very careful about speculating here, I think this may not be the one that we need to be worried about. But there's certainly potential for Omicron to recombine with Delta and for other variants to come about. So I think across Europe, all countries need to greatly increase their sequencing capacity so we have the ability to detect these early, because not every country can do that to the same extent.
Professor Martin McKee from the London School of Hygiene and Tropical Medicine, thank you very much.
Thank you.
Let's get more on this from DW correspondent Jack Parrock, who joins us from Brussels. Jack, what is the reaction there in Brussels to the high number of cases in many European countries?
Hi, Get. Well, at the moment, they are sort of sitting and watching exactly what's happening here in Brussels. We're back into a period of the pandemic, which is really about the healthcare situation on the ground in each of the European Union's member states. And the reality is still that healthcare is a national competence in the European Union. So each country is deciding exactly what it needs to do due to its caseload numbers. As we heard in the report, there are huge numbers. There's nearly 150,000 cases a day in Italy, for instance. Here in Belgium, where I am, the case numbers have doubled in the last week. And although we understand, and a lot of healthcare professionals and public health officials are saying that perhaps the Omicron variant has milder symptoms and doesn't result in so much hospitalization, the countries in Europe where we are seeing such huge numbers are starting to now consider different measures. In fact, before Christmas, the European Centre for Disease Prevention and Control raised concerns about Omicron and said that they would expect these huge surges of numbers in each of the EU's member states. And they actually suggested that there should be non-sanitary measures, so things like lockdowns, for instance. But we've seen over the weekend, as you'll know, in Amsterdam, for instance, huge anti-lockdown protests in which 30 people were arrested. There were violent clashes between the protesters and police. So politicians across the European Union are nervous about bringing in any measures, Gerhard.
Yeah, similarly here in Germany there were large protests. The example of Denmark, though, shows that a high vaccination rate against an infection with Omicron is just not sufficient. Boosters are a good answer. Are European countries now ramping up their vaccination campaigns?
They are certainly trying to, and the boosters have been a priority here in Europe and indeed across the world to try and prevent the serious effects of a COVID-19 infection. As you say, Denmark has a pretty high double-dose infection rate, so they've got somewhere near about 83.5%, but they are only about 42% boosted. So that leaves a large part of the population who could be potentially, susceptible to some of the more serious effects if they've only had 2 doses. As we heard in the report as well, Romania is very low on boosters. They've actually only got just over 40% of people who've had their 2 doses and only just over 5% who've had a booster shot. And across the European Union, sort of the highest numbers are into the 40%, but most countries are somewhere between maybe 15 and 30% of booster shots. So that really is the priority now. On top of that, though, additional measures are being considered. So controversial measures are being considered in France and Italy. For instance, limiting the green pass, so the vaccination, to only 6 months after you've had your booster. And also in those countries, they're considering restricting it so that the green pass that allows you to enter clubs, bars, restaurants, cinemas, etc., can only be used with vaccination, and that the PCR test isn't enough, so that people that don't want to be vaccinated would sort of consider getting vaccinated more because it will hinder their life if they don't.
Jack Parrock there in Brussels for us. Thank you, Jack.